this is fibula. Fibula is the lateral bone of the leg, and for its side determination there are a few points that you need to know, and they are that the upper part is being made by the head of fibula. This thing is the head of fibula, right? And this lower part is the lateral malleolus. It forms the lower part of the bone. So head of the fibula is always towards, it makes the upper part of the bone, and the lower part of the bone is being made by the lateral malleolus. Then this sharp yellow border is the anterior border. It's always present anteriorly. This sharp yellow border is the anterior border. So it is always anteriorly present. Then side determination, there is another point, which is that this elongated portion of the head is known as the apex or the styloid process. This apex or the styloid process always points towards posterior lateral aspect of the body. Now, what is posterior lateral aspect? It is posteriorly present and laterally, right? It is posteriorly and laterally present. So you get to know that this bone is the right side of the body, is of right side of the body. So in the bony features of the upper part of the bone, there is just one prominent thing. This pink thing is known as the apex of the head or the styloid process of the head, this pink thing, and that's all. Then we have in the lower part, we have this elongated portion. This is known as the lateral malleolus. It always points towards the lateral aspect of the body. Then if you see the lower part inferiorly, there is this yellow thing. There is a fossa here. This fossa is known as malleolar fossa, right? So there are just few points. This thing is known as the apex in the upper part of the bone. Then this thing is the lateral malleolus, and inferiorly we have a malleolar fossa. Right, now we will move on to the borders of the bone. As in the side determination, we discussed that this prominent border is the anterior border of the bone. It starts from the head of the fibula and it extends downwards, and when it reaches the lower part of the bone, it divides into two further lines. This thing, as you can see, it diverges from here. It diverges into two parts and encloses a triangular area in between this triangular area, right? So this anterior border divides it or diverges in its lower part and encloses a surface in between, a triangular surface. Now we have medial border, which is actually rarely traceable in the upper part, in the upper part, because it is conjoined with the anterior border, so you cannot trace it in the upper part of the bone. But in the lower part of the bone, it is actually traceable, and it is just a finger breadth away from the anterior border. This yellow thing is the anterior border, and this pink one is the medial border. So it is just a finger breadth away from the anterior border. So as you can see, it also ends at the lateral malleolus, but the posterior surface of the lateral malleolus. Now we have the posterior border of the bone. It starts from the apex or the styloid process of the head. Obviously it's the posterior border, so it would be present at the posterior aspect of the bone. So it starts from the styloid process, this purple border. It extends downwards and ends here, right? This purple border is the posterior border. From where did it start? It starts from the apex of the head or the styloid process. Now we have three surfaces. This surface between the medial border and the anterior border is known as the medial surface. The surface which is present between the anterior border and the posterior border is known as the anterior surface, this surface, right? Anterior border and the posterior border. Then we have a surface which is enclosed within the posterior border. This purple border is the posterior border, and the medial border, the pink border, this surface is known as the posterior surface.